There you go.
Yeah.
Okay. Well, welcome everybody to FitFoot U. Tonight we've got a special guest from Australia. His name is Simon Bartold, and I haven't really, other than the last week, really gotten a chance to talk to Simon because the one time we did cross paths at the run event down in Austin, he was very busy with his duties with Salomon. And Simon has the distinction of being both a podiatrist and a very high-level consultant in the world of biomechanics. He's had experiences with Salomon, with ASICS running shoes. He's got his own private consulting company now. He's a winner of the Richard O. Schuster Award for Biomechanics, which is sometimes unusual for it to be bestowed to somebody outside of North America. But in 2009, he got that award. And he has a message that I'm going to let him talk about, which is the integration of technology and the world of 3D print to our practices in podiatry, and those that are in allied healthcare practices like physical therapy. I suppose it applies to them as well. So welcome, Simon, and tell me a little bit about, the opportunity you see for practitioners with all that's come down the pike in this realm.
Thanks, Ben, and good morning, everybody, or good evening your time there in the USA. It's always a bit surreal to be talking on these time zone differences. I'm actually in the future, so it's actually Tuesday morning here now, so I work in the future. Thanks to everybody for joining us. Thanks for taking the time. Yes, look, I suppose the message really is just to, I guess, flag some of the challenges that we as clinicians will be facing in the next few years, if not already, in terms of what is possible with athletic footwear. So essentially, we're entering a brave new world here. So the traditional model where you might refer a client or a patient off to a running shoe store for a recommendation on footwear will very soon be a dead duck, because you will be taking all of that on in your own practices. And to give you a bit of an example of this, of what is possible right now. So right now, it is possible for you to collect biometric data, take all your biomechanical measurements, take your anthropometric measurements, upload that file to a facility in either Taiwan or Belgium, where they will 3D print a last for your patient. In other words, the three-dimensional model that is used to build the shoe. And they will then bespoke build that shoe for you with whatever modifications you might imagine. And they'll deliver it back into your practice, probably at an extra cost of about $20 US. So that is, it is possible for you to do that right now. So the moral of the story here is that the podiatric clinicians are going to, I guess, become the running shoe stores in the future, rather than having to send that out and I guess in some way lose that income to somebody else. You will be able to prescribe these shoes with an infinite number of variations from the comfort of your own consulting room. So it's pretty exciting. And it's not only that, but you'll be able to drill down on this to an extent where you will be able to prescribe footwear not only for a particular patient, but also for the sport they play and the position they play within that sport. So for example, if we take soccer, the requirements of well, let's take basketball as a better example. So the requirements of a point guard are quite different to the requirements of a center. So they're playing a different game essentially. So you will be able to prescribe changes in the viscosity of the midsole of the shoe to recognize the demands that player has, not only in the sport but within the sport. So very exciting times, Ben. I mean, all this is doable right here, right now.
Can you give me an example, Simon, of an actual team, or is it more individuals that you've done this technology with so far with the 3D print shoes, and perhaps integrating some of the biometric data? Because I have heard different things about it. It can be done, and I'm sure you are doing cases, I've talked with industry leaders like Paul Linton, and he feels that we're still a few years away from more mass consumer availability. So maybe fill in the gaps with that.
Yeah, so I think there's an important distinction to be made here. So I'm not talking about 3D printing shoes. I think 3D printing shoes is still a little way off. I hope everybody can understand my weird accent. I think 3D printing shoes is still a little way off simply because the printers are not fast enough. So we know we've got companies like Adidas who've invested a lot in projects like Futurecraft, which were essentially fully 3D printed shoes, but they could only build, round about in a year, they could build about 5,000 pairs in a year. Now, to put that in context, ASICS builds 1.5 million pairs of men's Kayano and 1.5 million pairs of women's Kayano. So from a commercial perspective, to be 3D printing 5,000 pairs is just not viable for the companies. So the printers aren't fast enough. So I think that is all way off. But what is exciting right now is the ability to 3D print the last of the client. So you can build the last, and then you can use traditional construction methods to build the shoe. But that shoe is bespoke because it's being built from an actual last of that person. And also that last is anatomical. In other words, rather than being, I don't have a last here to show you, but traditional lasts are completely flat on the bottom, okay? And that was a requirement of the manufacturing processes. In the last 2 or 3 years, the manufacturing processes have accelerated to a point where we can build a last, which, surprise, surprise, looks exactly like a foot. So it's completely rounded, it has an arch, it's contoured. And what that means is that you are distributing the pressure across the foot with the shoe much better than you would with the traditional last. It also means that rather than sitting on the shoe, you sit in the shoe. Now, I think probably what will happen in the very near future is we will see a little bit like some of the orthotic laboratories. We will see the big companies have libraries of lasts, hundreds, perhaps thousands of lasts. And clinicians will look at their patient and they'll say, right, I see this patient's got stage 2 HIV, and I see they've got other issues, they've got dorsal exostosis, whatever they might have. I can see from my file here that last number 237 is most suitable for this particular client. You simply send the order in, that's what comes back. Or you can have it bespoke made from that client's last. So that's doable. And you can see there's quite a difference between that and actually 3D printing a shoe, which is quite a cumbersome process.
Right. I had the opportunity to watch your interview with Benno, and you had one of your matrices that you had produced. It looked like a kind of a netting that I imagine would go, and this is a prototype Hoka shoe that was one of the first graphite ones I got a chance to try. But I imagine it would go right here through the midsole, this lattice being embedded in that, and you wouldn't see it unless they had some marketing feature that would show you the mesh.
Yeah, well, this is where it gets really exciting. And again, this technology is available right now. Is that we can build a 3D, we can 3D print a lattice made from whatever material, so we make it out of nylon, and that lattice is actually an orthotic device. So if you can picture in your mind, it might be more or less dense in certain areas, and the idea is that it is exactly like a 3D printed orthotic, excepting it is a lattice, so it's like a honeycomb. Now, what you then do is you embed that in the bottom unit and you backfill it with whatever that material might be. It might be EVA, it might be PU. If you're using PU, it gets even more exciting because you can bleed the viscosity. In other words, you can make it more or less viscous in the rear foot and more or less viscous in the forefoot, depending on whether you're engaging in more running or less running, or more jumping or less jumping. So the shoe, in effect, becomes the orthotic device. And that's the other thing that we need to start thinking about. I don't want people who are listening to this to think that I believe the shoe is ever going to replace an orthotic device, because I think there'll always be a place for orthotic devices, but the shoe will drill down and become way more functional than it is now. So it is possible to actually have these embedded devices in the shoes right now. So you can really start to, we talk about footwear prescription now, but we don't we can't really prescribe footwear. We don't really have enough ammunition to be able to do that. But in the very near future, we will be able to truly prescribe athletic footwear that's athlete and sport specific.
You touched on a point that I'd like you to elaborate on, which is viscosity. In your interview with Benno, it was very interesting. He said, and I sort of paraphrase, that viscosity did have effects in the heel, through the heel and possibly the midsole, with comfort and performance. However, and this was interesting because I have a follow-up question about something you worked on at ASICS in the forefoot. He felt that there was not a big role for tampering and adjusting viscosity materials in the forefoot. So everything right is context, Simon, but I'd like you to sort of elaborate a little bit on what your interpretation of that statement is.
Yeah, so Benno and I have had long discussions on this, and whenever I'm with him, I try to ask as many questions as I can. Benno has a very disconcerting habit in that when you ask him a question, there's often a prolonged period of silence, and usually when that happens, you think to yourself, Benno thinks I'm a complete idiot for asking that question, but he's actually just thinking. He's actually just he's formulating the answer to his question. So Benno quite often talks in theory. So and obviously his theories are often become fact, and he's just such an incredible brain. But I'm not sure that everybody would agree with that concept that viscosity may not be important in the rear foot. It's far more obvious in the forefoot, I beg your pardon. It's far more obvious in the rear foot for things like its ability to influence the peak braking moment, for example. So in other words, the horizontal force that opposes the contact of the foot. So it's obviously quite important there because viscosity can affect shear. But there's no reason at all why that would not also have an effect on the acceleration mode of running. So when we look at the AP, or the horizontal component of the ground reaction force, initially you have the braking force, and then once you get into propulsion, you have the acceleration force. So acceleration also is quite dependent on the viscosity and the shear of the material. But I think what Benno's saying is that stability is more important in the forefoot than it would be in the rear foot in that AP direction. So we're not talking about pronation, supination. We're talking about movement in the horizontal plane. So my interpretation of his comments is that's really what he's saying. But the other interesting thing about viscosity, and this is one of the things that he and I worked on a lot at Salomon, is the viscosity can have quite a profound effect on both the magnitude and the frequency of the input vibration. So when you hit the ground, you create a shock wave, it goes up through your system. It's like dropping a pebble into a pond, it creates a wave. And unless you can dissipate that wave, it will go all the way up to your head. And when you run, it will have quite severe consequences. And we also know it's very involved in injury. So we know it's involved in tendon, bone, muscle, and nerve damage. So if you can attenuate that vibration, then you can perhaps have a direct line to prevention of injury. And also almost certainly you'll reduce fatigue. So the viscosity is very important in attenuating the input vibration of a system. And that's one of the things that we worked for 4 or 5 years in France on when I was with Salomon there. So I think viscosity is quite important.
Well, I would agree with you to a large degree. I can tell you that, experientially, and I've remember quite distinctly when I first came across the field study that Benno had done. He was testing surfaces for tracks, and before we had the most recent track surfaces, and I don't know if his opinion would change, but his opinion then was that you can't really game the surface of the track to help performance at that particular time or decrease injuries. And I think he also felt the same with regards to the stiffness or softness of running shoes, that would not necessarily translate to any increased benefit for preventing injuries. Now, what's interesting is I remembered that comment. I think that sometimes, right, each sort of general statement has its own sort of sub compartments of things that happen. Like I have a deficient ACL and probably bone on bone or some fibrocartilage on my left knee. And I was doing a triathlon, finishing up, running on the concrete road. And then, and this might play into the tuning and the modulation of the vibrations. I found it more comfortable to run on the grass infield, and that's what I did. And that instantly decreased some of the discomfort, the sharp pains I was having at that point in the race. And granted, it was only a 10K at the end of a swim and a whatever 25-mile bike ride, whatever it was. But at that point, I was already fatiguing and feeling my knee quite a bit. So what is your thoughts on surfaces, both in running shoes and on fields, in terms of these situational things where we will discover that something is more comfortable with, which is a big tenet of Benno's in terms of finding your own comfort zone, but yet having this sort of proclamation that we can't really decrease injury rate and or performance. But in this particular case, that little circumstance did affect my comfort at that point in the race.
Yeah, well, this is a splendid example of an N=1, which we will have to listen to. So the moral to your story is that every single running athlete is different, and you can't apply single paradigms or single shoe recommendations to every athlete. It just doesn't work because the human organism is far too varied. What the point you bring up is one of the most important things to understand in biomechanics, and that is this concept of lower limb stiffness. And it's very easy to understand. So essentially what this tells us is that we've got this supercomputer up here called the brain, and the brain monitors every facet of input load every 50 milliseconds when you run, and it makes adjustments to the way your lower limb works as a spring. So what actually happens is if you're barefoot and you step from a soft surface onto a hard surface, the brain will recognize that. It will increase subtalar joint pronation, it will increase knee flexion, and it will change the compliance of your lower limb as a spring. In other words, it will make it more springy. If you do the opposite and you go from a hard surface onto a soft surface, it does exactly the same thing. It says, hey, this is a softer surface. I need to make the legs stiffer. So it will decrease knee flexion, it will decrease subtalar joint pronation, and it will make the spring stiffer. Now, of course, all of that has major implications in terms of athletic footwear. All of it has major implications in terms of track surfaces. And Benno has been at the forefront of this sort of work. And he actually stumbled onto this when he was working with Cirque du Soleil, the Canadian circus company. And they were all getting injuries. And basically, they were working on very softly sprung boards on the stage. And he did something very simple. He just increased the batten content of the stage to make it stiffer. And lo and behold, their injuries went away. So the problem here was that they were all operating on a surface that was too soft. And people gravitate towards soft things. So they think that cushioning in shoes is going to prevent injury. It won't. There's no science or research anywhere that will tell you that softer shoes will decrease injury. It just doesn't. It's not there. People gravitate towards softer surfaces thinking that they're necessarily going to be better for you. In your case, Ben, it was, but it may not be for the friend you run with. So this is the great beauty of being involved in treating athletes, that you need to treat every case differently, and you need to assess what's going on. You need to move away from the thought process that if somebody has a very stiff foot, that they would necessarily need increased cushioning, because that may not be the case. That's why it's so important to examine the proximal structures. You have to understand what's going on: low back, hip, knee, ankle. The ankle for me is by far the most important joint in the foot. It's way more important than the subtalar joint. The way it compensates has far more and far graver consequences than the subtalar joint. So I think that's a concept that people need to really jump on board with.
I'm going to ask you to expand on that bit about the ankle, but before we leave the subject of stiffness, you have a number of platforms that you meticulously weed through a bunch of biomechanic articles, and I noticed one that fits and segues here, which is the hard shoe and soft shoe article that you recently reviewed. Tell us a little bit about that and put it into context, because you can read these things and you see the subsets of numbers and the way they design the study, but maybe you can, illuminate and explain it in simple, clear terms.
Yeah, so there's an opportunity for me to shamelessly plug our website, which is called Bartold Clinical, www.bartoldclinical.com. And it's very interesting that we're talking about, Benno, and we're talking about these sorts of things. Yesterday, I wrote an article that looked at his comfort filter. So for those of you that are not aware, Benno Nigg in 2015 wrote a paper where he introduced two new paradigms. One's called the preferred motion pathway and the other's called the comfort filter. And essentially what he says is that in relation to running shoes, you will have a preferred motion pathway that will minimize your risk of injury, and it will improve your running economy. In other words, you won't use as much energy when you run. And that is dependent on nothing more or less than step-in comfort of the shoe. So in other words, if the shoe is comfortable, then it will enhance your preferred motion pathway. If it's not, then you won't operate in an optimal manner. Now, this has kind of been accepted as gospel, and it's very much been picked up by technical retailer and also a lot of podiatrists who are referring footwear. That's their only real parameter, is the shoe comfort. Not the things that the comfort filter ignores is it makes no recognition whatsoever of a little thing called the tissue stress.
We lost you for a moment here, at least on my end. Can you repeat that? Because I think that was an important point. We just lost you for about 5 seconds. Go ahead and re-summarize if you don't mind.
Yeah, sure. So I think that the comfort filter is only about step-in comfort. In other words, here, try this shoe on. How does it feel? It feels very comfortable. That's okay if you've got an uninjured population. But if you've got somebody who comes in with injury, then the tissue stress model becomes very important, because you have to figure out what is the load that has caused that injury, or what is the action within the sport that has caused the injury. Are we seeing a weakness in some area? Are we seeing a biomechanical deficit in a different area? What might it be? Now, the comfort filter doesn't recognize that at all. So I wrote this article, not attacking it, but basically saying, well, I don't know that the comfort filter is something that we should be basically putting all our eggs in that basket, because I don't think it works once you bring injury into account here. So that's just something for you guys to be considering. Now, in terms of soft shoe versus hard shoe, yeah, we try to be science-based when we look at all this sort of thing. And basically what you would expect is, if you get a cohort of runners, let's say we've got 10 runners, and you measure the vertical ground reaction force, in other words, how much the ground hits you when you hit it, most people would expect that if you put them into a softer shoe that you would reduce the vertical ground reaction force. What will actually happen in probably 10 out of 10 people is you'll increase the vertical ground reaction force. And you'll increase the vertical ground reaction force because your brain has recognized that shoe's softer. It's increased your line of stiffness, you've got a stiffer spring, so it increases the vertical ground reaction force. The exact same is true if you've got a harder shoe. When you've got a harder shoe, you'll see a decrease in the vertical impact load. So this is where it becomes very interesting with prescription of athletic footwear, because you can start to drill down on this for your individual athletes and say, okay, I've done my gait analysis, complete body gait analysis, looking at everything from head position to arm swing, etc., not foot analysis. And I've got a pretty fair idea of what this athlete is doing. They're injured. I've got a pretty good idea that they've got a slight delayed heel lift on their left side. So I think that they've probably got some issue with either their Achilles tendon or their tricep serrate. I understand the stress that's occurring on this particular athlete, and here's how I'm going to fix it. So that's the process you go through. It's an important point to make, because it's a little bit different. Well, actually, it's miles different from the model that most people are currently working on, and that is, are you pronating? And if you are, we'll put you in a shoe that fits you to vertical. I'm here to tell you that doesn't work, and I'm here to tell you that's not appropriate. That's We're not interested in fit the vertical model. We're interested in how do we shift the load? How do we change it? It may be that you want to reduce some pronation, but it may be that you want to speed up the transition from contact to toe-off. It may be that you want to reduce the abduction or increase the abduction, whatever it might be. It might be that the shoe is collapsing in the midfoot, and that's not providing enough full contact with the shoe. So all of these things are very important. And again, I get back to my comment about the ankle. Is there a lack of ankle joint dorsiflexion? That to me, that's a far more sinister issue than excessive subtalar joint pronation, whatever that is. And nobody in the known universe knows what excessive subtalar joint pronation is. We can't measure it. We don't know. We don't know how much is too much. We don't know how much is too little. So I think we're facing challenges in the paradigms and the thought processes, but we're starting to get a lot more analytical about this, and we should be starting to get better results with our athletes as a result of this.
I thought one of the interesting points, and I believe it was the interview that you did, or maybe it was one of Benno's other interviews, but I reviewed a couple in preparation for this, and he was talking about that seminal article he wrote about the paradigm shift from the normal kinematics line up to vertical. I guess it was in about 2001 or so that he wrote that. And that coincided very closely with the barefoot running movement. And that's actually how I first came into contact with Benno. He was one of the voices of reason in that whole big thing with Chris McDougall. And in my search with some of the stuff you did, guess what? His TED Talk cross-referenced in the Google search as I was looking for some past biomechanics stuff. And I have to say, even back then, it was just so romanticized. And the only, I think, silver lining to the whole thing, in my view, was that it brought great attention to biomechanics. Podiatrists certainly saw a lot of foot pathology as a result of overzealous Clydesdale class runners running down the street with their 5 fingers. So it did create a lot of discussion. But as you mentioned, and I'd be interested in some of your talks with Kevin Kirby. How does he reconcile? I know you believe in the Kirby skive. I still use it in my models, and I don't think you're necessarily downplaying that at all. But the whole idea of how we were getting things traditionally to vertical, and how does and I know he keeps very, very much abreast with what's happening in the world of biomechanics. But from conversations you've had, how has that shifted his view, and how does something like the Kirby skive integrate with that? I certainly like the idea of from a functional standpoint, you can have a very low profile orthotic and have that built right into the cant of the orthotic. So maybe give me a little perspective there.
Sure. Kevin's a very good friend of mine. He and I have the world's oldest and arguably best boy band. It's called the Tarsal Coalition. He's the lead singer, so obviously he's very temperamental. I'm the guitarist, so I have to put up with his antics. Kevin is a guy. It's quite difficult to change his mind on some things. Now, I love the Kirby skive. I think it appeals to me because its whole idea is that it's looking at changing force or load or stress, and it does that because it provides a supination moment right at the level of the sustentaculum tali. So this large angle provides a very specific counter movement within the orthotic device. So I think that's a really important way to look at this, rather than just trying to grab a heel and move it to vertical, because of course you can't do that. You've got too much fatty tissue. You can't do it with an orthotic, and you can't do it with a shoe.
I just want to give people a quick visual. Here is the sustentaculum tali for the non-anatomical folks that may just be lay people taking a look at this. And that is a critical point, as we discussed off camera, about how orthotics are addressed. A lot of my patients think it should be right there, but you'll get an orthotic back, and sometimes the rise of the arch is more proximal. anyway, continue.
Yep, that's exactly right. And I think that's what I like about it, that it does provide this fairly steep angle, a little more distally than a traditional orthotic device. And so it does offer that quite important counter rotation movement underneath that shelf of bone, the sustentecton talar. So you really are getting potential to really try to do something important with the device. It kind of feeds in quite nicely to the concept that he and I frequently disagree on athletic footwear. So Kevin's quite a proponent of motion control footwear. I think motion control footwear is a complete oxymoron and a dinosaur. So I don't think you can control motion with shoes. You can change load and you can change stress. You can't control motion. And as a point of reference there, if you really think that you can bring a shoe back to vertical, bring a foot back to vertical with the shoe, then look at all the studies that have cut little tiny windows in the heel and see what the foot is actually doing within the shoe. So the shoe might look vertical, but the foot's happily pronating within the shoe. So that's what happens. So I've been a big advocate of saying, you know what, motion control strategies like dual density midsoles, like plastic bits and pieces that are put into the shoe, the only thing those things really do is add weight to the shoe. And you can achieve far more by manipulating the geometry of the shoe. So more rounded contours, looking at how quickly you can transition from contact through to toe off. We call that forward transition. They're really important things. And this is where Kevin and I butt heads. There's very little science, in fact, probably no science that really in studies with decent power, decent numbers, shows that motion control footwear really has any significant effect, especially on injury. There's a researcher out of Luxembourg called Laurent Malisso. He's done a couple that have shown that motion control footwear does change kinematics, but he's doing it with a shoe that has a very large forefoot varus wedge. Now, there's not a commercially available shoe on the market that has a very large forefoot varus wedge. So the research is really kind of null and void because, yeah, you can stop pronation. I mean, if I got a shoe and hammered a nail at the level of the first MPJ and put somebody in that shoe, they're never going to pronate. They've got a fairly strong stimulus to stop them pronating. So you can make people stop pronating, but that sort of science to me is a bit pointless because that's not what we do in the real world. So, yeah, so Kevin and I, we have this ongoing discussion about this, and I'd say at the moment I'm winning. If he was on here, he'd probably say I'm losing, but it's a very interesting discussion.
So you mentioned forefoot varus, and I recently, after a discussion with Doug Ritchie, I read a good bit of his book. It's very detailed. It has to do with the twisted plate theory, and then he expands on that into our development from primates and how the torque of the Achilles is, and many discussions. But within that, he had a segment talking about the power of the forefoot valgus wedge for offloading the fascia on strain gauges in a study that was done. So, that to me got me thinking that, where originally kind of the old Merton Root way of thinking, for every 4 to 5 degrees varus, 1 or 2 of forefoot varus in the forefoot, that changed my thought. And now, in fact, I have tried sometimes valgus wedges or valgus strips in orthotic prescription. Give me your take on that study that Doug referenced with. Did you ever see this with the anatomic strain gauges on actual cadaver models with the fascia and looking at valgus forces and such?
Yeah, I did. We actually published one on that exact topic. So the first one was done by a great mate of mine, a fellow called Gazer Kogler, and Gazer was the first one to really look at this. We followed this up with a study through the University of Melbourne with fresh frozen cadavers, and it was a really interesting study. So what we actually did is, when I use taping for plantar heel pain, I always tape forefoot into valgus. So I invert the rear foot and I evert the forefoot. And anecdotally, I get very good results with that, but I wanted to know what it was doing. So we actually surgically implanted 4 different strain gauges into the plantar fascia. We loaded the plantar fascia up to 900 newtons, which is about the equivalent of weight bearing. And then we looked at it in a tape versus no tape situation. Now, we thought the taping might reduce the strain in the plantar fascia by about 5%. We thought that would be a reasonable result. In 7 fresh frozen cadavers, we were able to average a reduction of the strain in the plantar fascia by 48% with that particular taping. So there is no question in my mind whatsoever that valgus wedging for florid acute plantar heel pain is probably a very good strategy.
About how much valgus were you using in your study? About how many degrees roughly? Do you remember?
About 10 degrees. Yeah, it's very hard to obviously. It's very hard to measure that accurately with taping because it's about feel. But with my taping, I'm very aggressive. So when people sort of step up after I put the taping on, they kind of say, "What the heck have you done to me? I can barely walk." But of course, taping listens off very quickly. So within an hour or so, it's actually quite comfortable. But I'm very aggressive. I put a large plantar flexion load on the first rate, and I do evert the forefoot quite a bit.
I wanted to stay on the forefoot before we move on and talk about something you did with ASICs, and maybe you can tell me a little bit more about it. You're referenced here, and I just saw this actually today. I was looking through an old Biomechanics magazine, and this was wedge brings new angle to treating hallux limitus. And this was an article in, over 12 or 13 years ago, May of 2008. And this was actually largely talking about the cluffy wedge, which was developed by James Clow of Montana. I'll let you explain it because you're probably more familiar. I haven't used a lot of them. I think I've seen adaptations. A lot of it harkens back to some of Howard Dannenberg's stuff with the first ray. This whole subject is very near and dear to my heart because I worked on something, and this is a shameless plug for a turf toe splint I developed with Orthopedic Sleeves First, a worldwide company that has a flexible ribbon, so to speak, polyurethane that we found anecdotally and in at least some ground reactive force, not a full study, but just a test run in a biomechanics lab decreased some of the ground reactive force going into the first ray. But tell me a little bit about if you feel that is a relevant strategy. Why aren't we necessarily seeing that cluffy wedge introduced into more shoes that could be easily put into one of the drop-in insoles that comes with the shoe? Give me some background on your view with that.
Okay. So I get my specimen here. So look, I think we probably don't look at this enough. So I think what you're doing with the turf toe device you've made there is very admirable. I mean, we need to start thinking more about this sort of stuff. So we need to get away from this sort of, I guess, generalized prescription of orthotic devices. So I think a lot of people, they're busy, they just think, yeah, no worries, 4-degree inverted device, that'll be fine, and away you go. And even worse, we deal with people who tick that ubiquitous box in the top right-hand corner of the prescription pad that says respiratory discretion, which absolutely appalls me, but that does happen. So, we are experts. We've done our investigation, and the most important thing we can do is think about the load, think about the force. How are we going to change it? What the cluffy wedge does with hallux limitus, and it's quite interesting, is, obviously with hallux limitus, we've got a situation where we may have some jamming of the proximal phalanx of the hallux on the first metatarsal. We're not getting enough plantar flexion of the first ray to allow clearance of that proximal phalanx. So that's one of the issues with hallux limitus, hallux rigidus. So what the cluffy wedge does is it actually provides a little piece of material underneath this proximal phalanx to dorsiflex it, so that it can theoretically clear the joint and allow increased plantar flexion of the first metatarsal. So that's the rationale behind it. Now, I have used the cluffy wedge quite a bit, and I'm not aware of any published research on this, but I have to say my experiences with it have been pretty positive. And again, when you think about the mechanics of the joint, and this is something that Kevin's very, very good at. I mean, his understanding of anatomy and joint biomechanics is second to none. So he'd be a good bloke to be on this discussion as well. But I do think that mechanically that makes sense. And I do think that we should be using more of these sorts of thought processes in terms of what are we trying to achieve. Morton's extensions. Are we using fascial accommodations and everybody has plantar heel pain? My argument would be, why wouldn't you do that? That makes sense that you would want to be putting that fascial accommodation into the positive cast to allow the plantar fascia to do its job. So yeah, I think that maybe we should be the people who get really good results are people who think outside the box, and they do actually think about what you're trying to change, and I do think that's quite important.
So without getting too far into the weeds, tell me a little bit about, did that lead to something that functionally worked with your work with ASICs in the forefoot? Now they've referenced, and it's funny, they've got you listed as Simon or Bartoli, so they put an Italian spin on your name. I guess the editor didn't catch that. But they talked about a thermoplastic forefoot thing that you did with an ASICS shoe. I don't know if that was around, because this is in the context of this article of treating hallux limitus. Do you remember what they were referencing there?
Yeah, I do. I get called all sorts of names. That's fine.
Did that innovation work? Looking back at it now, do you think it worked, and do you think it still works? Tell us about what it was.
This is going back a long way. So this is actually a show I worked on with ASICS called the Gel Creed, which nobody would remember, but it actually morphed into the 3000 range. So ASICS has the 1000, 2000, 3000 range, and it didn't have a cluffy wedge, but what it did basically have was a Morton's extension. It wasn't in thermoplastic, it was in EVA. So what we did was we extended very high density EVA beyond the first metatarsal in that particular shoe, solely with the thought process that we wanted to improve takeoff supination. So this was designed functionally for somebody that we thought was pronating a bit more from foot flat into propulsion than we would have liked. So late stage pronation, if you like. And so we built this shoe, which actually lasted quite a long time, because, as I say, it went through into another shoe called the Verdict, and then eventually it went into the 3000 range. It might even still be around, I'm not sure. But that was what we did, and that was the logic behind it.
Okay, let's move on now to something that I think a lot of people have personal experience with, which is Achilles problems with the watershed area, and the controversies and confounding evidence that we have revolving around using 12 millimeter standard elevations, which I think you are a big proponent of, at least with some of your work with previously with ASICS. I don't know how much you talked about that with Solomon. And the study that you were involved with, which showed something a little different, which was a walking study. And I think that's important too. A lot of these studies that are referenced, right, Simon, we might be talking about runners, we might be talking about elite runners, we might be talking about recreational runners, we might be talking about walkers, and a very different mechanics. But in this particular study, with the acoustic measuring of the Achilles, and you can expand on the validity of that measurement, it was found that the barefoot folks had less tensile strain going through the Achilles. So I'll let you take it from here. There's a lot of different thoughts on it. So how do you put this puzzle together?
Yeah, so there's a lot of potential segues that question into talking about barefoot running and minimalist running, which in fact does have some clinical benefits if you know how to exploit it. But let's talk about the study. So this was a complex study, and we actually published about 5 papers as a result of this, and it's called an acoustic transmission study. So what we did is we built a device that shot a sound beam up the Achilles tendon, and we had a little transceiver that was able to measure the time it took for that sound wave to pass up the Achilles tendon at 4 different points. And the reason we did that is there is a direct relationship between strain in the Achilles tendon and the time it takes for a sound beam to pass up the Achilles tendon. So in other words, if it's faster, then there's more load on the Achilles tendon. If it's slower, there's less load on the Achilles tendon. And we then also built a little ultrasound transceiver that we were able to look at the fascicle lengthening of the Achilles tendon. And we then looked at barefoot, a normal 10 millimeter traditional running shoe raise, and then we progressively increased the height of the raise up to 22 millimeters. And the long and short of all this was, as you say, Ben, is that we were comparing barefoot to these other situations, and in fact, when you put the individual into a normal running shoe, there was an increase in the strain in the Achilles tendon, so it increased it, which is very counterintuitive. But again, remember, this is walking, not running, and it was on a treadmill, which is not on normal ground. So there are some limitations here. And then we had to add another 12 millimeter raise to the shoe to just get it to the point of strain of barefoot. So in other words, a total of 22 millimeters of raise before we got the strain down in the Achilles tendon to the point it was where we were barefoot. So that was a bit counterintuitive, but it was a sophisticated and pretty well planned out study. And as I say, we published 5 papers, I think, in pretty high impact journals on that. So what does that tell us? Does that tell us that heel raises are not effective? Well, it doesn't, because we can't amortize this to running. This was a walking study. So for me, it's a bit of an oddity, really, in terms of what we saw. And I certainly wouldn't recommend that you all go out there and stop using heel raises for unloading the Achilles. What I would say is that if you're going to do it, probably 5 millimeters won't cut it. You probably need to go significantly higher than that. So you do need to have a significant raise.
What has been your argument with, I've heard some people say that with any heel that we have in a shoe, and so I guess we have to differentiate, because we're talking about Achilles tendinosis and treating that versus now the everyday person who doesn't have an Achilles problem. And we have, this slight heel wedge and this thought process of how there's, the natural drop of the forefoot. And you've probably heard this sort of debate from, I guess, this purist anatomical perspective.
Yeah, so this gets back to the whole barefoot debate, which kind of blew up in 2009 when Dan Lieberman published his article in Nature Journal, and Chris McDougall wrote his boy's own adventure called Born to Run, which I've read and enjoyed, but went completely off the rails at page 176, where he decided he was going to attack the footwear industry, which was not very sensible. But basically, this became an extremely polarized argument, and I was very involved in this argument along with people like Kevin. Kevin got called the angry podiatrist. Believe it or not, I had death threats because I dared to challenge this concept that barefoot running was the way to go. So it was quite nasty. But at the end of all of this, we're now some 12 years down the track, and there's been a lot of research on all of this, and there is general agreement about what a shoe, a standard traditional 10 millimeter raise shoe and barefoot does. And the upshot is that if you go into a traditional shoe with a 10 millimeter raise, it will increase, but this is with running, okay? Important distinction. It will increase the external knee joint moments, and it will decrease the external ankle joint moments. In other words, it will increase load on the knee, and it will decrease load on the Achilles tendon and ankle. If you go to barefoot or a zero drop shoe, it will decrease the load on the knee, and it will increase the load on the ankle on the Achilles tendon. Now, there's probably 20 or 30 published articles in high impact journals that all come to the same conclusion. This is the actual measurement that they're taking. So for clinicians, there are a few things that we can take out of this. The first thing we can take out of this is if you've got a 15-year-old girl who has recalcitrant patellofemoral pain, can't get rid of it, done all the right things, then it would be completely sensible for you to be recommending some judicious training, either barefoot or in a minimized shoe, because it is going to reduce the load at the knee, and particularly it's going to reduce the load around the patellofemoral joint. So that is an eminently sensible thing to do. If you had somebody who came in and they had recalcitrant Achilles tendinopathy, you might like to consider, especially if they were running in minimized footwear, you would probably say, listen, we're going to give that a break and we're going to put you into something that's got a bit more substance underneath the heel and use a more traditional shoe. There is, however, a caveat to this, and the caveat is that the current way we manage Achilles tendinopathy is we load it, we load the tendon. It's very, very important. So you don't rest it, you load it. That's how they get better, and we do it in a very progressive manner. Now, one of the ways you can load the Achilles tendon is to run barefoot. So I could probably make a fairly strong case to say that you'd want to be right by their side all through this process, but you may want to start a very defined and structured program, either using a lower drop shoe or doing some work barefoot, because that will load the Achilles tendon. You just have to make sure you do it in the correct manner and you know how you are structuring your exercise prescription. So that's my take on it, Ben.
Well, bravo, you navigated through all the landmines of that question. That really cleared a lot of things up, and you put it in very good context with the knee and the ankle. That was good. It brings up a question that I have. I haven't seen a lot of good, and this is a personal question because my son has OsgoodSchlatters, and would there be any solution in footwear that you can think of to take stress off that growth plate, just under the kneecap, over the tibia there, that might ease that tension and the growth osteophyte activity that's occurring?
So there's a lot of myth and folklore around all the lower limb osteochondroses. We've just actually written a course. It's about 30 hours of CPT on all the osteochondroses from leg calf Berthei's disease all the way down to sesamoid insufficiency. OsgoodSchlatters in particular, there is a lot of mismanagement of this, because what a lot of people don't know about OsgoodSchlatters disease is that it is not necessarily a self-limiting disease. So OsgoodSchlatters, in the literature, the age range for OsgoodSchlatters disease is from 9 to 43. So OsgoodSchlatters disease does not necessarily go away once you have closure of the growth plates. So it can continue for many, many years, and it's often misdiagnosed because you're assuming that it can't be OsgoodSchlatters disease because you're 30 years old. How could it be? Take it on board that it can be OsgoodSchlatters disease. How old is your son, Ben?
He's 16, and
yeah,
he's very active, and he's going through his weed phase. So he's more vertical than horizontal right now.
Yeah,
and he's a late bloomer too. He, a year ago he was about 4'10", and now he's probably about 5'4", 5'4.5", 5'5".
Yeah. So this is a typical presentation, and obviously this is. It's one of the big issues with the growing athlete. We have the challenges of kids who might be playing school sport, they might be playing club sport, they might be playing representative sport, they can literally be playing and training more than a professional athlete. And they're doing this with a very vulnerable musculoskeletal system. So look, honestly, the management of this condition is about stress management. So you've got to somehow figure out how you can reduce the load on this vulnerable area where the patellar tendon inserts into the tibial tuberosity. In terms of footwear, is there much you can do with that? I actually don't think there is a great deal you can do with that. I think this revolves more around exercise prescriptions. So again, judicious loading of the structure, although that may sound counterintuitive, it is actually important because with a condition like Osgood-Schlatters disease, you're dealing with a derelict load. What we're wanting to do is we're wanting to try to strengthen the way the tendon inserts into the tibial tuberosity. Stretching is a very controversial topic, so we could make a case to say that stretching is completely worthless, and we could make a case to say that stretching in a condition like this is very, very important. I personally believe it's important, especially when you've had somebody gone through a rapid growth spurt. The only other thing you can really do is diverted activities. So we don't ever recommend complete rest from activity, because that has other implications. But trying other activities until it just settles down. The whole gig with Osgood-Schlatters disease is it's going to be a series of peaks and troughs until hopefully it does resolve once we get closer to the growth plate. That is what happens in most people, but not always. So the goal here is that it really is just managing those peaks and troughs as best you can with the tools you have available: exercise therapy, stress management, those sorts of things are very, very important. The other thing I was going to say, which I've completely forgotten, so I won't say it.
Well, let me just piggyback on something you said. What about tissue management? What about and I'm just spitballing here because I've used shockwave before in Seaver's disease, which is the posterior calcaneal growth plate, and I would never hazard recommending something that I hadn't seen some literature on. But what do you think the role of shockwave might be in some of these growth plate enthesiopathies and growth plate problems?
Look, I think it can have a role. So one of the conditions that that extracorporeal shockwave therapy is most effective for is lateral epicondylitis, so tennis elbow or pitcher's elbow. It's very effective for that, and that is probably the condition that has the most longitudinal studies. The most long-term studies have been on that condition. So it would make sense that if it works well for that, then you could try it in other conditions where we've got the tendon inserting into the bone. So things like calcaneal apophysitis, things like Osgood-Schlatters, Sinding, Larsen, Johansson, it would make sense. The only caveat here is that, of course, the elbow is not a weight-bearing joint, whereas the knee and where the Achilles inserts into the heel, we've got very large loads occurring there. Honestly, my take on this would be, because it is management of the peaks and troughs, I'd probably give it a go. I don't see a downside to that other than it might be quite painful. But anything you can do to stimulate healing there is probably going to be beneficial. I am aware of some of my colleagues in Australia do use it for calcaneal apophysitis, and they do report reasonable results with it. So, yeah, I think it's probably worth thinking about it.
All right, let's move on to a very hot topic and one that you've been quite part of the conversation. Let's talk about the Nike 4%. I was kind of grasping at straws trying to get a grip on it, and then I just recently saw a discussion on this idea of the teeter-totter effect, which was published by Benno recently, I think in 2020. In his first discussion with you, again, I'm paraphrasing, he said, "I don't know why it works." And then subsequently, I don't know if he and his team blew the shoe apart and came upon an epiphany that there's a bent carbon plate in there. I know that he also referenced some other shoes, which we can get to in a moment. But before I get too complicated with the question, kind of give me your sort of take on what you know about the technology to date.
Yeah, well, I mean, personally, I'm absolutely fascinated by this whole discussion, this whole development in footwear innovation, and I will go on record and say I absolutely love it. Some people hate it; they're calling it EPO for the feet and all this sort of jazz. I don't buy into that at all. I think we live in a world of technology, and we're striving for things to improve the athlete. So all these things, super shoes, and there are currently about 15 different manufacturers who have what we would consider to be a super shoe. For me to include a shoe in the super shoe club, it must have a carbon fiber plate. It must have fairly substantial and fairly high-tech midsole foam, and it must have a rocker. So it must have geometry from the rear foot to the forefoot. So they're the three fundamental things that define a super shoe. Now, Benno's published the teeter-totter effect, as you said, very recently, and he's actually had a few people who've had a fair crack at debunking this. Most notably, some of the people who were involved in the development of the Nike Vaporfly 4%, which was the very first of the super shoes. That shoe first appeared in the Olympic marathon trials before the Rio Games, so back in 2016. It became commercially available in 2017, and it has now morphed into a family of shoes. So we've gone through the 4%, the next percent, we had the Alpha Fly, we've got the Alpha Fly next percent, we've got the Vaporfly 2%. So we've got a whole family of shoes, and they're all very high performance shoes. They all fulfill those roles. So carbon fiber plate, it has to have a rocker, and it has to have a foam.
Can I just show a
Nike
visual before you go on? Let me just so people have context. This is the carbon fiber embedded in the midsole. You can't see it, and this is the rocker that you spoke of. This happens to be a Hoka Carbon X. This is a Brooks version of that same concept in general, and so they each have their own little iterations. But I just wanted to, sorry to interrupt, show that visual.
No, that's okay. And they're all different. So they all have, importantly, they all have different foams, and perhaps even more importantly, they all have different placement of the carbon fiber plate. So the discussion we have to have here, so to put this in context, Nike at the moment own every single world record, bar one, from 10,000 meters to marathon in men and women. There's an extraordinary domination, and those world records are owned in one of the original Nike Vaporfly 4% family of shoes. So absolutely dominating the whole scene. The only record that's not held by them is the men's half marathon record, which is held by an athlete who wore an Adidas shoe. So, and of course, we've seen the greatest of all time, Eliud Kipchoge, who in a very contrived format went below 2 hours for the marathon distance, which I sat glued to the screen in absolute amazement watching that. But the discussion here is, okay, we know these shoes are fast. We know these shoes are offering the athletes an advantage. We know that advantage is somewhere between 4 and 8% in terms of their energy. So if you're offering an athlete a 4% energetic advantage over the marathon distance, you are having a massive effect on how that athlete gets fatigued. Now, if you don't believe me, watch Galen Rupp run his fastest time ever for the marathon, 2:03. He looks like he's about to die as he goes over the finish line. And then watch Kipchoge at the end of the Ineos 159 challenge, who crosses the finish line in 1 hour, 59 minutes and 40 seconds. And he looks like he could turn around and run another 26 miles back in the other direction. Zero fatigue, just looks fresh as a daisy. So there's something going on with these shoes that is quite extraordinary. The question is it the carbon fiber plate? Is it the rocker? Or is it the foam? Now, the people who are most involved in this, so one of the people who's been most involved is a very well-known sports scientist by the name of a biomechanist by the name of Walter Hoogkamer. And Walter Hoogkamer was one of the chief architects of the Vaporfly 4%. He's since moved outside the cloistered halls of Nike, and he's now working at the University of Massachusetts in Amherst, heading up their biomechanics lab. So he's now seen as being completely independent, although he's a scientist beyond repute. When he was publishing data, he was in Nike. So people said, he's a Nike scientist, that's all nonsense. But that's not fair at all, because the studies were very good. And he was the guy who showed, yes, it is a 4% advantage. Now, talking to him and other people like Roger Cram, the general opinion is that the plate probably only has a fairly small role to play. This feeds back into Benno's teeter-totter effect. But the foam probably has a large role to play. And the rocker is the great unknown, because the rocker, if you look at a rocker, it's like a half bicycle wheel, which is a model of perpetual movement. This is why Hoka was so successful initially with their huge shoe, with a huge midsole and a large rocker, because they used it with ultramarathon runners. And because it has this large rocker, it improves the turnover process, so they weren't getting as fatigued. That's how Hoka got their foothold in the business. So I personally think the geometry of the shoe is super important. Nike use a foam called Zumex, which is a Pebax or a Peba foam. Peba is a thermoplastic. It's normally used in things like the hard plate of a football boot. But the beauty of Peba or Pebax is that you can go into the kitchen and you can modify the recipe. So it's a dual chain molecule. So by changing certain parts of the molecule, you can either make it more or less flexible. You can make it more or less viscous. So they developed a technique to turn this hard thermoplastic into a foam. It's about 20% lighter than any other foam. It has about almost 30% better energy return than any other foam. And if you can increase energy return, you reduce the energetic cost. So that's a long ramble there, Ben, but basically the smart money says that the carbon fiber plate in a 4% advantage is possibly worth 1%. The foam's possibly worth 3%, and the rocker, who knows, it might be adding a lot more. The other thing that's very important is the placement of the carbon fiber plate and the geometry of the plate. So Nike have published pretty compelling data to say that a curved plate is much more effective than a flat plate, which a couple of the other super shoes are using. And that makes sense in terms of a teeter-totter effect. And also how close it's placed to the foot is important. If it's embedded deeper in the midsole, it seems to be less effective than if it's closer to the foot. So a lot of things to consider in these highly technical, very innovative products.
Let me ask you then, so was it established that there was indeed a bend and it wasn't just a curvilinear plate, like a very sharp angle of that carbon plate embedded in the Nike 4%?
Sorry.
Is that your understanding, that there's like a real bend, like a fulcrum, if you will?
Oh, absolutely. Absolutely. And Adidas have taken that to the next level. The very first of the Adidas super shoes, which wasn't all that successful, they were playing around with a 45-degree kick up in the carbon fiber plate from the metatarsals on. They scrapped that, and what they've now done is they've embedded a series of what they call energy rods. So it's got 5 separate rods that extend into the forefoot that look a little bit like the metatarsals. Now, and also embedded with a very thick midsole, so 40 millimeters in the rear foot, and I think it is 34 in the forefoot, so 6 mil drop. So again, very innovative process, and that Adios is probably the shoe that is seen as being the most likely challenger to the Vaporfly family, and indeed that is the shoe that was used in the men's half marathon world record. So the other shoes that you showed there, the Carbon X and the Hyperion 2. Yeah, that's the Carbon X, and then the Brooks.
And then this was the
Hyperion
Brooks
2.
shoe I showed.
It's an interesting shoe, this Hyperion 2. The first version of this, the Hyperion, was what we in Australia would call an absolute bush pig. It was a horrible shoe, it didn't work at all well. And it was seen that Brooks probably rushed that shoe to market to try to get competitive with Nike, and everybody was scrambling to try to get stuff ready for Tokyo 2020, which of course didn't eventuate. So everybody had another year to work on their product for super shoes. Brooks went back to the drawing board. They completely changed the setup. They changed the foam. Instead of using air-infused EVA, they infused it with nitrogen. Much better foam, much better shoe, much more responsive. The Hyperion Elite 2 is, it's right up there with some of the best shoes. But there's a lot of variability between the different shoes.
I will add this, because I just had one of the Brooks techno gurus on. He wasn't at a high level, but was given the information at least that they and it gives to me, a lot of integrity to Brooks, that they allowed their athletes to wear other shoes because they didn't feel that their elite competition shoes for their athletes. And I think, by the way, they had one from Australia. I'll have to go back after and give you the athlete's name, but it wasn't up to snuff. So, ready for Tokyo. So they allowed them to wear other shoes. So that was kind of a feel good anecdote that I just learned of recently. It's not all Willy Wonka and the great Nike chocolate factory over there.
Yeah, if people are interested, we in the wash-up of the Olympic Games held recently, they do the medal tally with all the countries and who wins what. Well, we decided to do a shoe medal tally. So we tallied up. We looked at every event that involved running, so including things like triathlon and steeplechase. We didn't include any field events at all. And we looked at which companies won how many medals. And it's very, very eye-opening that in terms of the dominance of Nike. Now, of course, Nike have more money than the entire GDP of Australia. So they can pretty much buy anything they want, and they do buy the best athletes. But they're absolutely dominant in terms of the footwear. One of the very interesting things that Nike did, and I'm not sure whether it was marketing genius or dirty pull, but they provided a white Project Vaporfly shoe, so completely unbranded, no hint at all that it's a Nike shoe, and they made that available to all athletes. So if you're a Brooks sponsored athlete or an ASICS sponsored athlete, you would be able to go get that shoe, put the ASICS stripes on it, put the Brooks logo on it if you wanted, and you go out and run in that shoe. Everybody knew it was a Nike shoe, but it's branded as Brooks or ASICS. So how's that?
Yeah,
that's pretty cool. That's a pretty ballsy move, I would have thought, and there were a few athletes that took that offer up.
I have a follow-up question for you on materials. You recently referenced the effect of material characteristics on shoe soles, on muscle activation, and energy aspects during running as one of Benno's great seminal papers back in 2002. I guess this was an in-house kind of thing he did at the Human Performance Laboratory in Calgary, because I didn't see a journal associated with it, but or maybe it was republished somewhere. But tell me a little bit about that. And I did want to just throw an anecdote in, because I try all different sorts of shoes, and I like the variability, because I feel like it's just doing almost a cross-training workout, as long as the shoe isn't detrimental, to what I'm doing training-wise. But one of the, before all these more fancy shoes came out, I really liked the initial wear I got from the material from the one of the original Adidas Boost shoes, whatever that material was. So on that note, tell me a little bit about what was impressive to you about that paper and what it concluded, and give us some context.
Yeah, well, maybe before we talk about what Benno's up to, you just brought up a really interesting point about mixing things up a bit. And I often get injured why runners get injured, and I say, well, this is why I think runners get injured. I think runners get injured because they get up in the morning, they put on their running shorts, they put on their running shoes, they walk out the front door, and they turn right and go for a run, and they always turn right. They never turn left. So they're always running on the same camber, on the same surface, in the same direction. We're all time poor. That's how we run. But if they run 5 times a week, if only they turn left twice a week and turn right 3 times a week, they're completely mixing up the input signal. If you vary the shoes you wear, you completely mix up the input signal. If you choose to run 4 times a week and go 10 bin bowling once a week, then you're mixing up the input signal, or even go and run on some trails. This is probably the single most important injury prevention strategy for runners, to mix up the input signal, because the human body hates repetitive cumulative load. That's what causes injury in runners. So that's a little homily there for people, that it's a very important piece of information, a very simple you can give to your runner. Turn left instead of turning right all the time. Now, in terms of Benno, so Benno's on a mission. Benno's 82 years old. And Benno's got a mind like a steel trap. I mean, when you sit down with Benno and start very obvious you're talking to somebody who's operating on an entirely different intellectual plane. It's very disconcerting. Benno's mission before he dies, and he's in rude good health at the moment, is to solve this issue of vibration and injury. And he's been working on this for at least 10 years. And that's what we were working on in depth at Salomon in France. We spent many millions of euros trying to solve this issue. We got the French Atomic Energy Corporation involved. We looked at all sorts of different systems. We looked at piezoelectric systems. We looked at rheomagnetic systems. We looked at many, many different things to try to reduce vibration. And we also did some very interesting studies. So I was working closely with our main running biomechanist, a lady called Dr. Marlene Giandolini. And Marlene put together this very interesting study that I was lucky enough to be involved in. And we were able to map the frequency of vibration in every tissue, 24 tissues from the calcaneus up to the cervical spine. So we knew the frequency at which these tissues vibrated. And we were able to look at things like the Achilles tendon. So I can tell you the Achilles tendon vibrates between 10 and 30 hertz. That's its range. Now, if you have a shoe that also vibrates at between 10 and 30 hertz, you get something called resonance. Resonance is what happens when you hit a baseball with a baseball bat off the sweet spot. You get that very unpleasant vibration. Okay. A resonance is what caused the Tacoma Bridge to fall into the river way back in the day. Wind came down the valley, 36 miles per hour, just happened to correspond with the vibration frequency of the bridge, went into a sine wave pattern, fell into the valley, only because of vibration. So we know this happens. So that the technique here is that if you build a shoe that vibrates between 10 and 30 hertz, then it most likely will injure your Achilles tendon. If you build a shoe that vibrates beyond 30 hertz or under 10 hertz, it'll offload your Achilles tendon. So this is what Benno's working on. We finally came up with a shoe at Salomon just before I left that we were able to present this data to Benno, and we came up with a system that involved materials and construction techniques that reduced the total vibration in a shoe by about 4 decibels. When we presented this to Benno, he literally nearly fell off his chair and said, "That's impossible." We said, "No, it's not. Here's the data." So we're getting much, much closer to that. What we haven't quite cracked is this Benno's concept of how you must tune a shoe to specific tissues. But we're getting close to that, Ben, because we're circling back to where we started this discussion, saying, hey, you know what? We can now build these shoes that have changes in viscosity, which change the frequencies. So we can manipulate the shoe even for specific tissue. If somebody does have Achilles tendinopathy, we can make sure that they're not in that 10 to 30 hertz range. So it's kind of mind-blowing, I know, but it's here, it's here, and it is happening, and it's going to happen. So that's Benno's mission. And, I think probably his great legacy will be that he was the person who pushed this onward. To give you an idea of how important vibration is, there are about 9 to 11 separate input loads. So think about things like pressure, ground reaction force, accelerations, joint moments, etc. More than 20% of all the input load when you run is vibration. More than 20%. But it's this great black hole that nobody's looked at. Everybody's been so focused on vertical ground reaction force and using cushioning to change that, which doesn't work, that vibration's just been sitting there on the side, vibrating away, causing problems, and no one's really looked at it. So I think this will be Benno's great legacy, that he's really put the spotlight on this and said, it's important for a number of reasons: for injury, for fatigue in the athlete, for performance, for comfort, all these things.
Are we accurately, on that note, measuring internal joint compartment pressures or torques inside joints? I know we have ground reactive force. He spoke specifically about the importance of internal torques in joints. How accurate are our models right now with reflecting that with ground reactive force?
Oh, look, the models have been accurate for ages. So, if you've got a force plate you can very accurately measure joint moments very accurately. You can also model it these days in the computer with our finite element modeling capability. You can do so much of this in the computer without, and this is great in the time of COVID. None of the labs are open. So, but what you can do now with the computer models is so good that in our world in athletic footwear, we do most of our modeling in the computer. So we can basically have a really good idea how a shoe or a design component of the shoe is going to work before we even put it on a human foot. We know from that modeling. So it's very, very accurate.
I've got another task for you to think about, and maybe this is something you can think about in some of your consulting that you do with shoe companies. This is a Salomon shoe that I like a lot. This is one of their, probably precedes when you were there. It looks like it's the XA Pro. It's a hiking shoe. It's a low cut hiking shoe, and on the bottom here, you'll see a pretty good wear pattern on the outsole. You probably know better, if there's any carbon in this outsole or what the composition is. But what I will tell you in wear, and I don't know how well you can see it here, but in wear, once the little nipples came off and wore off this surface or the ridges, I think it had little studs though. This became a very slippery shoe with any moisture. Talk to me a little bit about that. And I'm still waiting for a more grabby shoe. We got all kinds of things that, the NFL is doing with little tricks that they've done with the football and so forth. Tell me some of your thoughts on coefficient of friction and wearing, and maybe I just overbaked that shoe a little bit and wore it too long.
Yeah, well, first of all, I'd like to say that I've had no involvement in hiking shoes with Salomon whatsoever, so it's not my fault. However, I do have a great interest in trail running, and I would reference you to a new shoe that you may not be familiar with, which is just been released by a couple of industry icons, a fellow called Dave Dombrow and Kevin Fallon, who are ex-Nike, ex-Puma, ex-Under Armour, and they started up their own company called Speedland. And they've just built the most amazing trail running shoe. It's carbon fiber plated. It costs, if you don't mind, $375 per pair. But they basically built the shoe with no compromises at all. And interestingly, the lugs that are used for grip and trail running shoes, you can cut them to modify the height depending on how and where you run. It's a really interesting concept.
Cool.
Actually.
What's the name of the shoe?
Yeah, it's really cool. And you can also, it's quite sustainable. Another passion of mine is sustainability in the footwear industry is super important. So you can reuse the carbon fiber plate, you can take it off and you can put it in your next shoe. So a very, very interesting project if people want to Google Speedland and have a look at that shoe. It's very, very interesting. Now, grip is quite important. So Salomon have a proprietary rubber, which they call Contour Grip. A lot of companies get other external companies involved, like Michelin are very involved with Adidas and other companies, and they develop specific rubber compounds for grip, much like they would in motor racing, much like they would vary the grip of rubber for motor racing, and that of course is very dependent on the conditions. So you can't go out racing in the wet on a slick tire. It's only designed for when the track's warm. So carbon rubber is also very important. So carbon rubber is rubber that obviously has carbon infused in it. It's very high abrasion, so it resists wear, but it's very slippery. Blown rubber, on the other hand, is rubber that has air blown into it. It is not very durable at all, but it's very grippy. So what you're suffering from here, Ben, is probably a shoe that you have worn past its use by date. And essentially, I think that you're probably getting to a point where the carbonized rubber is probably overtaking the blown rubber, and so the shoe is becoming slippery.
Yeah, well, and I don't know how similar this is in design to the one you referenced, the Speedland, but this is what I got this in New Paltz. This is La Sportiva. and it's got what feels to me to be a little softer sole, but I find that this grips great for hiking. I actually did a rock scramble near the Catskills, and it performed great, and it's a nice trail runner as well.
I'm going to show you. I'm going to show you a little shoe here in terms of grip. Just bear with me 1 sec. So this is a shoe that my colleague and great mate Paul Griffin and I developed for a Belgian company called OsgoodSchlatters. And we spent a lot of time thinking about how you might design a shoe for grip. And this is what we came up with.
Interesting.
So you can see that what this does is it tells directional stories. So it has a very strong braking component in the rear foot. And you can see we've talked about geometry, and you can see it's got the little shark's teeth here, right? So this is very much about what happens when you've got a rear foot bias. We then looked at medial and lateral sides of the shoe, and then we looked at what you needed in terms of propulsion. You know, these stories are all about, okay, what happens if you're hiking or you're trail running and you're going down a hill? When you go down a hill, your heel is in contact, you need to be braking. When you're going up a hill, you need to be clawing your way up the hill. So this directional story is very important. This is an interesting feature that Paul came up with. This is a cuboid support area, so it's designed to move. Now, this is not a hiking or trail running shoe. This is a shoe built for elite field hockey. And this shoe was built specifically for the Belgian Olympic team. And they wore this shoe when they won the gold medal a few weeks ago. So this is a really interesting shoe. And of course, field hockey is played on a water-based pitch. So it is a very, very wet surface. So we had to think about a lot of it. You can also see the flex points here are very important, providing these different platforms of support for the shoe. So a lot of things you need to think about when you start to design very specific footwear, but you can take a lot of lessons from this in terms of hiking and trail running, particularly in the direction of the lugs and what they actually look like. I'd very much like to build.
Well, I think that's a brilliant shoe, and I would challenge you to develop something along those lines for or consult with a company in the trail running and hiking or light hiking shoes that would help a little bit with toe bang, which you get when you're going down the hill when you've ascended the mountain and are on your way down. That becomes a real literal pain in your forefoot and toe area. Well, we're getting an hour and a half in, and this has been great. I want to finish with a couple things. Number one, before I forget, what was for those interested, the shoes that you did work on with Solomon that you felt had that great performance advantage? Did you have a couple of the models that the prototypes that are available, or is it?
Yep. Again, I'll just grab it and show you. Hang on
Yep.
1 sec. I love this. I love this shoe because they made it for me.
That's sweet.
Yeah,
oh yeah, there you go. Is that your first signature shoe, Simon?
But this is the shoe called the Predict, and this is a very, very interesting shoe. This is probably the shoe. I've been in this industry a long time, and this is probably the product I'm most proud of because it's so radical. This shoe is based entirely on geometry. So we talk about heel counters and the requirement for stiffness here. That's how much stiffness it's got in the heel counter. Now this is quite interesting. This is a two-piece upper. This part here, the rear part, was not built in a shoe factory. It was built in the factory that builds all the bras for the Victoria's Secrets model. So it's built in a bra factory. And the reason it was built in a bra factory is that those guys are absolute experts at form fitting. So we said, rightio, we want you to apply what you know to provide us with perfect fit for the rear foot. So that was a really important thing. Now, the thing that you'll notice most about this is, okay, if you have a look at that, and we took as inspiration for that design, this, so you see what we're trying to do there. So we looked at disarticulating the entire midsole along the lines of the major joints of the foot, so that you have 1, 2, 3, 4, 5, 6, 11 different platforms, so that as you progress from contact through to propulsion, all of these platforms decouple and they provide an instantaneous platform of support. That was the whole idea of the shoe. Did it work? We took this shoe, poor old Marlene, we took the shoe into the lab with 24 subjects 5 times. And the reason we did it is the data we were getting back, we didn't believe. So we were seeing things like 20% reduction in the hip adduction moment. We were seeing huge reductions in joint load with this shoe. And frankly, we just didn't believe it. In the end, we had to believe it. And we thought, well, there must be some sort of energetic cost to this. So we made her go back in and do gas analysis on all the runners. And there was no penalty there either. So the moral of the story here is, I'm not saying this is the world's greatest shoe, although I am very proud of it. The moral of the story here is, this is a very, very flexible shoe. This shoe is more stable than a Nike Pegasus. We know because we measured it. So it's very, very flexible. So it interacts with the foot very, very well, but it's very stable, and it achieves that stability through geometry and nothing else. It weighs in at about 230 grams. So I'm not quite sure what that is in ounces, but it's well under 9 ounces. So it's also very, very light. So it's a very interesting shoe from that perspective. This is called the Predict. The Predict 2, which looks even better, has just come on the market. Excuse me, I'm just waiting for a pair to get into and have a run in as we speak. So the Salomon are sending me a pair at the moment. But a really interesting example of how you think outside the box and you try to take the cues from what Leonardo da Vinci called the best piece of engineering ever conceived. That is the human foot. So
that's brilliant. I really like that ingenuity with that shoe. It reminds me of that other shoe, and I should know the name right off the top of my head. I'm sure it's very different. It's very popular. It's got the little O and the T, or the O and the I. You know what I'm? On cloud.
On running.
Yeah. On cloud. What's your take on that shoe, real quick? I always dissuade people because it seems a little too flimsy when they're coming in with their Achilles tendonitis or plantar fasciitis. But
yeah, well, Roger Federer has just bought into the company, so it can't be all bad.
I know you have to choose your words delicately here, but what from a strictly functional standpoint, to me, people coming in with foot pathology, I immediately tell them to get a different shoe than that on cloud. But I'm what is it? On running? Yeah. On running. Excuse me.
Yeah.
What am I misguiding them? What do you think?
I think maybe you are. I think you may be underestimating the shoe. I mean, Benno also works as a consultant with that company. They're a Swiss company, and he is Swiss. I think that my take on this, and I actually know the guys who started the company quite well. My take on it would be that I'm pretty sure they don't actually know what they've got. I think they've got a very strong technical story that they maybe haven't exploited as well as they can. So Benno must be looking at this and rubbing his hands, because when you see a product like that, and for those of you that aren't familiar with on running, the technology involves a series of hollow, I don't know what you'd call it, tubes, I guess, and they can compress. Now, obviously, if you're talking about tuning a shoe, it's very easy to do that, Ben, with this sort of shoe. So you can either make those tubes more or less stiff, and then suddenly you are starting to be able to tell some very sophisticated technical stories. They have not done that yet, and it surprised me they haven't done that. Would I recommend this for somebody who is an accomplished runner who runs a lot? It probably wouldn't be my first choice. What I can tell you is, in terms of comfort, they're very comfortable. Their step-in comfort's amongst the best in the industry. Would we regard them as a high-performance shoe yet? I think they're on the cusp of that, but maybe not quite competitive yet. But I really don't think they're very far off at all. I mean, they're doing really well in the USA. They're a real company with a bullet.
Well, I'll have to have another look and see what they're all about.
I think you should.
Yep. I'm gonna have one last sort of summary question, and this is going to be very directed and in tune with a PM News article that was recently out there by a guy by the name of Gerard Shapiro. He's a podiatrist. And then I'm going to let you have final comments. But first, since this will be transcribed in some format with podiatry management, I thought it might be appropriate for you to sort of answer this headline yourself. What do you think is wrong with why are podiatry school graduates not grasping biomechanics? You certainly bring a lot of life to it with this very vibrant discussion, and I have a lot of interest, and I hope that shows. I mean, I did a lot of research for this and for Doug's book, and I've learned so much, and it's changed how I practice incrementally. What do you think I mean, and let me just frame it. You know, we're in an economic environment here in the US where from a United Healthcare, you may get $530 for a bunion if you're lucky, $530 US. I just had my, just to the left of me, what they call in the industry a chimney wrap, and they parged it, and then what else did they do? They did a little grading on some flooding I was having, $8,000 later. So perhaps I should rethink my my career as a mason. But what do you think the solution is, and if you have any other comments on what you think the problem is?
Yeah, well, I know my two great friends, both Kevin and Doug, you know, that they sort of bemoan this situation, you know, often and loud. And Kevin in particular, I think, you know, he's just tearing his hair out because he's very concerned about what is going on. Now, I can't really comment on the situation in the USA because I'm not intimate with that. But from my perspective,
on your neck of the woods, what do you think? I mean, I see in the literature Australia is very involved. When I was looking up,
look, it all starts at an undergraduate level. So, I mean, if your undergraduate training is completely biased towards surgery, then that's the way you're going to end up. So, if you're not really being taught biomechanics, and biomechanics is a bit of an interesting term because we get taught podiatric biomechanics, right? Biomechanics is a much bigger, broader world than that, and often we don't get equipped to talk about it in great detail. You have to learn that externally. In Australia, we don't have the same options as surgeons here, so we do surgery here, but it's nothing like as embedded as it is in the USA. So I guess my perspective or my impression would be it's a little bit like, you know, if the only tool you've got is the hammer, everything's going to look like a nail, right? So you're not going to get too embedded in biomechanics if you're spending all day doing surgery. That's what you're going to focus on. So I think that it is incumbent upon the schools to really try to give the students the career choices, because, you know, one of the things I don't understand, Ben, is in the whole world, I can think of probably 2 or 3 podiatrists in the world who I would regard as real experts in rheumatology. Now, can somebody explain that to me? Because if ever there was a structure that was affected by rheumatoid arthritis, it's the foot. How come people aren't being given that option to develop areas of expertise in hardcore medicine in that direction? We can offer so much there. 3 people in the world who I would consider experts. So it's the same thing that if our only focus at an undergraduate level is, there's a bunion, you know, go and sort that out. There's a neuroma, that's that, you know, you want to sort out a, you know, condition in the rear foot, that's what you do. Well, you know, that's what you're going to do. You're not going to be really looking at how you might get involved in sports medicine, for example. I mean, sports medicine is an unbelievable career. You know, it's taken me to 4 Olympic Games. It's taken me to 2 World Track and Field Championships. It's allowed me to do things I never would have thought possible in any profession. So you just have to, I guess, have the people who have the vision to be able to say, it's more than just surgery. There are options. You could do rheumatology. You could do sports medicine. What we're doing now is wound care and surgery. And no one really has the answers for that other than it all starts in the schools.
Well, I think one thing that might add to this, and hopefully, things like this, and there's plenty of them out there with, during the pandemic, these forums, if you will encourage the schools to embrace more ideas from across the pond and cross-pollination. If, for instance, when I was looking up Hallux limitus and carbon plates, I couldn't really find a lot of specific stuff on carbon plates and their function, but I did find a couple Australian articles that referenced the mid-tarsus arthritis and carbon plates. So at least it was a starting point. And there was some mention of some kinematic stuff that was done with Hallux limitus. So to me, if there were more forums that had virtual discussions, that might perhaps inject a little energy. I hope you'll consider involvement with the American Academy of Podiatric Sports Medicine. It's a wonderful organization. I know you've talked to our executor and some of the board people, and I have. By the way, I have no influence in that group whatsoever, other than I'm a fellow of the academy, and I know you have your own Australian version or international version of things you've participated with. Do you see a way that these organizations might be able to work more closely in tandem, realistically? There's a lot of egos involved with sports medicine, so. How do you think that these organizations could collaborate more efficiently?
Oh, you have a wonderful ace in the hole in Rita Yates, who is entirely with that ego. And
she's going to love this on the recording. Yes. Yes.
So, I mean, I have had quite a bit of involvement with Rita over the years, and some of my great friends.
She's got so much people wisdom and situation wisdom. But anyway, go ahead. Yeah.
So I know Rob Coronello really well, and Michael Chin, and some of the guys who are quite involved, and Dave over at Midwestern University, who's an ex-president, so have had quite a bit of involvement. I would love to see collaboration. I mean, one of the things that's happening here that I'm finding slightly disconcerting in our world of sports podiatry is that there is a very big shift towards a singular focus just on exercise. In sports medicine, that's a very important part of it, so looking at exercise as medicine or exercise as rehab. But sports podiatry is much, much bigger than that. And as soon as you start to focus on just one aspect and say, in fact, our academy, which was the Australian Academy of Podiatric Sports Medicine, it's had its name changed to Sports and Exercise Podiatrists Australia. No mention of medicine at all. I find that quite concerning, because it's saying we're only going to be involved in exercise medicine now, and we don't care about anything else. In any endeavor, as soon as you start, this is like the barefoot argument, as soon as you say there is one true and only righteous way, then you're going down the wrong path. You need to recognize that there is a lot to it that is involved. You need to understand medicine, you need to understand drug prescription, you need to understand exercise, you need to understand orthotic therapy, biomechanics, blah, 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 blah. There's a lot to it. And so I would love to see some collaboration between the Academy or even the APMA, getting more involved in global collaborations. There's so much to offer. In Australia, we're very research-based here now. We have a lot of podiatrists in PhD programs, so we're getting very good research going out there. We've got fantastic institutions like La Trobe University, Melbourne University. They're world leading in terms of the research coming out of podiatry. Some really great stuff coming out of Spain. Italy is emerging in terms of really good information coming out of there for podiatry. So, I think that this global collaboration would be very good. I think it would help the situation in America, where biomechanics is kind of taking a back seat, and information dissemination is always worthwhile, right? So I'd love to see that happen.
Yep. I did want to, before I end it and give you the last word, just mention something that we also had in a previous conversation, which I thought was a great analogy, funny, but so true. What I find now, and I spoke of this to you, is that right now we're in interesting times with small box running stores, boutique running stores trying to survive against Amazon, etc. Podiatry practices that are smaller, trying their best to, do their thing. And then you have other entities, physical therapy, etc. So everybody is vying for the patient runner, sports medicine candidate, weekend warrior. And there doesn't always seem to be the same degree of collaboration, again, on that collaboration theme. So there's these vertical silos of sorts. And I know that you mentioned that, like, for instance, Kevin Kirby still goes to his local Fleet Feet and does, basically for just being a shoe geek, loves to be in that environment and discuss shoes and so forth. What do you think is going to help turn this sort of unhappy marriage, as you called it? And I think you're accurate. I think that is the state of where we are. There's just not as much collaboration as there used to be, is the truth of the matter.
Yeah.
Amongst running stores, podiatry, industry.
I hate to offend any of my colleagues, but the fact of the matter is that most podiatrists know less about athletic footwear than most technical retail. I mean, I can show you technical retails in the USA who have PhDs in biomechanics. Some of them have PhDs in physiology. These are people with an advanced level of knowledge, and their only interaction all day is looking at running shoes and trying to understand what they do. So they have advanced knowledge. Our responsibility as podiatrists is to understand that we have this body of knowledge out there, and the technique is to try to find the guys that really do know this stuff, and that's who you deal with. Obviously, podiatry has a massive input into the whole situation, but you're right, it's the communication, and sometimes it's the ego. So, I would say, look, let's park the egos, and let's understand that retail shouldn't be talking about injury. We should be trying to learn from retail in terms of current product on the market, which is evolving at a huge rate. We've talked about Nike, and we've just talked about the challenges of understanding what they're doing. I don't think Nike know what they're doing. I think they got, in some ways, they got where they got through dumb, blind, good luck, but very rapidly evolving. So let's learn from retail. Let's educate retail in terms of what we can do. The two, podiatry and retail, should be symbiotic. There's no doubt we should be able to work together very, very well. But as soon as we start getting competitive with them, well, then everybody loses. That's not a good way to be. So I think at the moment there are some challenges, and it can be a bit of an unhappy marriage, as I said, but it doesn't have to be that way if everybody says, okay, let's just take the ego out of it. Let's see what we can learn from each other, and that seems like a sensible approach to me.
Cool. So it'll be like one of those light beer Super Bowl commercial moments where it's kind of kumbaya and we all get together, hopefully. Well, you've shed a lot of light tonight. It's been gripping. We're just short of 2 hours. You've been very gracious with your time. I do want to give you a last word. It could be funny story. So are you still running, by the way? Are you? What's your form of exercise? I do try to ask.
Yeah, so I haven't checked my miles. I think for the month so far I've done about 140 Ks, so approaching 100 miles in a month. So that's about what I do now.
So you've been running. Doing some running. That's great. That's great. So you get to product test your own prototypes. That's pretty cool. You wouldn't
believe how many boxes of shoes I've got in my office here. So.
No, well, listen, if you ever get to that variability wear testing study, I will be one of your subjects for sure. What I would invite you to do, if you like, in maybe 6 months, 8 months after some more literature is out, maybe we can have a few other 3D print guys. There's Dr. Paul Langer. He's in Minnesota, and maybe a couple other people, and just sort of have more of a panel discussion, and that might be very illuminating and hopefully cross-pollinate some information that the Academy is dispensing as well. They have their big meeting in Seattle. I don't know if that's an opportunity for you to be there. I know you've got a full calendar, and right now we've got a lot of hurdles with international travel.
Yeah,
But
the biggest problem for me at the moment is my government won't let me leave the country. Or they will let me leave the country, but they won't let me re-enter.
yeah, yeah,
So much as I'd love to be jumping on a plane and going somewhere, and my wife is from San Diego, so she hasn't seen her family in forever. So we're
right.
champing at the bit to get back to the USA. So
Well, I
yeah,
wish
hopefully that will happen
I wish you
by the end
speed
of the year.
in that endeavor for you and your wife. And I do hope that we'll in the not hopefully it won't be another 4 or 5 years before we get to meet in person again. And we'll do this forum hopefully in 6 to 8 months. I'll ping you and see if a time that might work and that coincides with some of the other guys. Any last words that you'd like to share before we sign out? You'll have one last word.
No, just thank you to everybody who tuned in, and thank you, Ben, for having me on this show. I've really enjoyed the chat. We've covered a lot of territory, and hopefully people have found it interesting and got something out of it.
I'll send you the whole thing on YouTube. You'll eventually get a copy of the. I'll have Barry send you the magazine article that we do for PM News if you don't already get that. And thanks again. You really did a solid job. You handled a lot of difficult, complex questions and made it very easy to understand. So I thank you again.